I'm going to talk about end of life care because that's one of the chapters in my book about the NHS. My interest has always been triggered by being a GP and trying to help people at the end of their lives, and that balance between how much pain are they in, how much relief do we continue to give people, or do we let them slip away with their pain controlled, maybe not giving them the 10th and 11th lot of antibiotics that they might otherwise have if they were aged much younger and were not at the end of life. It's complicated. I did actually look after a 2-year-old for a year who we fostered at home, and that was at his end of life. And unfortunately, in retrospect, I tried to keep him alive for an extra 3 weeks by suddenly finding him comatose and he died. And I then resuscitated him as I would have done any other person as a GP, so that with a stab of adrenaline in his heart and me doing resuscitation, we managed to get him to hospital, but he only lived for another 3 weeks. And all that effort to keep him alive gave him a miserable last 3 weeks rather than just slipping away happily. I've got more and more involved with my interest in end of life, just seeing what happens in hospices, and I so respect them. I mean, these days people are helped with a hospice care in the end of life, maybe that's their last 6 months, and there's so much more prevention and thinking of the person as a whole person and staying at home happily for as long as they can, not necessarily being admitted if they didn't need to be. But one of the things that I do feel concerned about with hospices is how much of their funding comes from the NHS, and the hospice near me that I'm hoping is going to benefit from the proceeds from this book, the Dougie Mac we call it, in North Staffordshire, then as far as I know, gets about 3 million a year from the NHS and needs to raise another 20 million from charity shops, from donations, to provide that great service that I've just been describing, where you're looking after the whole person and keeping them at home for as long as possible with a happier, more comfortable life.